We will go to Professor Avadhesh for his talk on role of suprachoroidal triamcinolone and hyperbaric oxygen therapy for CME and RP.
Can I have my slides, please?
I think the participants have to sign in a paper. Somebody can. Yeah, and they will take them across. They have to sign, no? This is what? He is Professor Avadhesh, no?
No.
Avadhesh.
Professor Avadhesh, he is the previous one. He is standing. This is the wrong one.
Avadhesh. Yes.
Yeah.
Good morning, everyone. So I'll be presenting on role of suprachoroidal triamcinolone and hyperbaric oxygen therapy for macular edema in retinitis pigmentosa. So as we all know, macular edema is important cause of central vision defect in retinitis pigmentosa. There are multiple therapeutic modalities which have been tried but very limited success. Most recently, steroids in the form of Ozurdex implant and PST has been tried, but because of their high cost and increased side effects, there are newer modalities which are coming like suprachoroidal triamcinolone, which has been recently tried in various etiologies of macular edema with good success. Also, there is a sparse literature on use of hyperbaric oxygen therapy, and it has been shown to be efficacious, but those cases are very few. So this report investigates the potential benefit of adjuvant role of suprachoroidal triamcinolone and hyperbaric oxygen therapy. So my case is a 35-year-old male serving soldier. He presented with diminution of vision in both his eyes for last 10 years, and recently he started having metamorphopsia, and his visual acuity dropped to 6/36 in both the eyes. The fundus examination revealed a classical RP type of picture wherein there was arterial attenuation and deposition of these bony corpuscular pigments. His optical coherence tomography showed macular edema in both the eyes with intraretinal fluid and cystic spaces. And a fundus fluorescent angiography confirmed this cystoid macular edema. He had extinguished ERG waves and had hardly any central vision and peripheral vision left. So as he felt, though the vision was equal in both eyes, but he felt left eye was not that good. So we tried suprachoroidal triamcinolone in the left eye, and this we did with our innovative technique, which was described almost 2 years back. It is published in IJO, and it has been tried in various other diseases. So here what we do, we take a 26 gauge needle and we take outer sheath of a 22 gauge cannula, so that we can make a needle where just the beveled end, which is roughly around 1 millimeters or 900 microns, is exposed. This is later confirmed with the help of calipers, so that the only beveled part goes in when we inject the drug. So like a standard injection procedure, we clean and drape the eye, and then we mark 4 millimeters from the limbus. We can go slightly posterior also. And then with the help of this needle with 4 milligram of triamcinolone in 0.1 ml, we go perpendicular to the sclera and we apply gentle pressure so that there is a small dimple on the sclera, and then effortlessly we inject the drug into the suprachoroidal space. The only other precaution you have to take, that the beveled part of the needle should be pointing posteriorly so that the drug can effortlessly diffuse posteriorly. So this is the OCT of the left eye done after 24 hours of the injection, and you can see already the suprachoroidal triamcinolone has started showing its effect wherein the macular edema has reduced in the left eye, and this is the anterior segment OCT where we confirm the location of the drug in the suprachoroidal space. So this patient, along with suprachoroidal triamcinolone, underwent 10 sessions of hyperbaric oxygen therapy. We are lucky because we have a center who deals with aerospace medicine. So he was given, as per the protocol, 10 sessions of hyperbaric oxygen, and then he was regularly followed up for 1 year. Left eye, which had received suprachoroidal triamcinolone along with hyperbaric oxygen, maintained improved earlier and maintained a vision of 6/9 till 1 year. So this is pre and post in the left eye after hyperbaric oxygen therapy and injection 4 milligram of suprachoroidal triamcinolone. This is a comparative OCT at the baseline and at the end of 6 months. So the mechanism of hyperbaric oxygen therapy, though it is not fully understood, but physiologically it is when we increase the oxygen concentration of the dissolved oxygen in the plasma, there is better tissue oxygenation of RP pump. However, more trials are required. Similarly, suprachoroidal triamcinolone is because of the targeted delivery of the drug. The side effect profile is very less as it has been shown in various trials, and this case demonstrates successful management of macular edema in RP combining these two therapies. Thank you.
How many cases you had?
This was one case which I have documented, but after that we have followed up 2 other cases also with good results, sir.
Is it due to the triamcinolone or due to hyperbaric oxygen?
Sir, I think it is the effect of both, wherein the triamcinolone has an adjuvant role because the left eye, which was the eye where we had done the intervention, the vision improved faster in that, and the quality of vision was maintained till 1 year follow-up.
That is, the improvement in macular edema was more in the combination.
Yes, sir. In the combination. Yes, sir.
Any improvement in fields was seen?
Field, there was no significant improvement in ERG or the fields, but central vision, the quality of vision was good. There was no metamorphopsia.
Any effect of hyperbaric oxygen on the brain,
On the ma'am?
in the central nervous system, brain?
On the in the right eye, the vision had improved. The macular edema had reduced, but it started recurring at the end of 1 year, whereas in the left eye, the macular thickness was maintained.
No, she wants to ask any systemic effects of this hyperbaric
No,
oxygen.
there were no systemic side effects because all these patients, they were before undergoing hyperbaric therapy, they are screened for any ENT or any other potential complications which can arrive. So pre-hyperbaric oxygen therapy, we rule out all those diseases if there are any risk factors for any complications. So in this case, there was no complication.
Because it is mentioned in the literature also, hyperbaric oxygen causes some cerebral infarcts
Okay.
in the brain.
So,
That's why I asked.
but in our center, we have a hyperbaric chamber, and for various diseases like non-healing ulcers, diabetic foods, we keep giving. So I'm not really aware that whether there are any side effects because procedure screening is important in all these cases. Maybe high-risk cases would develop all those complications.
And one thing more, did you compare this suprachoroidal triamcinolone with the subtendons, posterior subtendons?
Not in this case, but in other cases we have compared, and the incidence of increased IOP is more in subtenon, plus the efficacy is also not that fantastic as it is seen in macular edema with suprachoroidal injections. And the advantage of this technique is that it can be done with the easily available sterile material in our ORs, and the hindrance of using patented catheters and needles, that is not there in this technique.
What are the chances of perforation while giving this injection?
I would have given more than 200, 300 injections in various conditions, but once you calibrate and you just make sure that only 900 to 1 millimeter of the beveled edge is exposed, I don't think there is any chance. But yes, theoretically in high myopes where the sclera could be thinner, there could be a theoretical risk.
You can try a microperimetry over the macula
yes.
so that you can demonstrate the increase in improvement
Yes.
in macula.
Maybe
Because fields are
further-
not that sensitive
Yes.
for normal fields.
Yes.
Thank you, Dr. Avadhesh.